Hello, my name is Adrian Wagg. I'm the Alberta Health Services Professor of Healthy Aging at the University of Alberta in Edmonton. And I'm here to talk a bit about healthy aging and physical and mental well-being in older people. In trying to define what you mean by an active, healthy lifestyle as an older person, you're actually taking into account a lot of factors. You're taking into account personal history, pre-existing health conditions, and other factors which you might need to manage to maintain a healthy lifestyle. But what research has shown is that keeping physically fit, socially engaged, intellectually engaged, and leading a healthy lifestyle in terms of eating habits, not smoking, moderate alcohol, leads to a higher level of life satisfaction and better quality of life. And this in itself is associated with longevity. Fewer people in later life engage with a physical activity than when they were younger, and many more fail to meet what might be the minimal recommended amounts. But we do know that even a 30-minute walk per day will improve your physical well-being, keep you mobile, and make you feel better. If you can't do it, then you should try at least to do the best you're able to within your physical limitations, and slowly build up your speed and stamina over weeks. There's a nice app called the Couch to 5K program, which many younger people use, and adopting a similar approach, although maybe not with the absolute target, would be the right thing for many of us to do. So get up and keep moving is the important thing. And even more importantly, find someone to do it with. You're much less likely to stick to things and to do things if you're doing them on your own. Many people are concerned about dementia, and for a lot of people that's a worse prospect of disease at end of life than even some cancers. So there is some evidence around maintaining healthy brains, and that's again around physical exercise, intellectual activity and social engagement. And the evidence suggests that even taking part in one intellectually engaging activity per day, whether that be puzzles, whether that be quizzes, whether that be online brain training activity, keeping your mind active is extremely important to maintain your brain health. Likewise, the so-called Mediterranean diet is really important, and there seems to be an association between better cognitive health and good nutrition in later life. Evidence from populations suggests that the better a person's perceived quality of life, the longer they live. And quality of life, of course, is a multi-dimensional concept which involves physical health, psychological health, spiritual well-being, socio-economic status, and so-called well-offness. So paying attention to those, of course, is largely important in midlife. But in late life, again, we're talking about maintaining physical fitness, social engagement, maintaining a sense of community, maintaining and developing close, good quality relationships, all seem to be extremely important. So as many people will have noticed that the changes in your body that occur with aging tend to mean that we run a bit to fat. More importantly, we lose muscle mass and we may be less physically active. So yes, we can maintain our physical activity, and that might be a minimum of a 30-minute walk, enough to get the pulse up, but not enough to get us breathless. That will maintain general fitness. For heart health, you need to get a bit breathless so that you can't maybe talk and walk at the same time. To combat the loss of muscle, then resistance exercises become important. So exercises against some weights, whether that be a can of beans or the small weights people buy to use in gyms, or rubber bands with some resistance, that doesn't matter, but the resistance appears to be very important. People are often interested in the links between physical and mental health, and undoubtedly one has a huge impact upon the other. Poor physical health often precedes poor mental health, and likewise poor mental health can lead to behaviours which may lead to poor physical health. And it's important to be aware of one's mental health and mood because, again, depression is very common and commonly associated with other chronic diseases of later life. One thing that people often neglect is sleep quality. Undoubtedly, an interrupted, fragmented pattern of sleep, which is not refreshing, is very bad for you. And not only in terms of your psychological well-being, but in terms maintaining a good temperament with a life partner, for instance, but also in terms of poor health outcomes. So if your sleep is obviously troubled, whether that be by having to get up to go to the toilet many times, or is fragmented because of being woken up by snoring, there are medical interventions which can be used to treat that. Maintaining good sleep hygiene, the things you do to get a good night's sleep, is very important. So not having that nightcap of alcohol before you go to bed, because although it might get you to sleep, it will lead to fragmented and fitful sleep. Making sure that you don't have screens at night. Your bedroom should be for two things, for sleep and sex, not for watching westerns or listening to the radio. And not going to sleep to bed just because you're bored. Going to bed when you're tired is really important. So there are lots of resources on the internet and with seniors associations about maintaining good sleep hygiene. So take advantage of those and take some things to heart. Many people talk about what constitutes healthy diet, and of course Health Canada has recommendations about intake for many things. Often caffeine comes up, and the current recommendation is for no more than 3 to 4 brewed cups of coffee per day. Caffeine is a stimulant. It can, when taken late at night, keep people awake and lead to poor sleep. And certainly withdrawing caffeine has bad effects. It can make people nervous and agitated. So find out what works for you. Certain health conditions are exacerbated by large amounts of caffeine. Certain heart irregularities of rhythm might be precipitated or worsened, such as atrial fibrillation. And likewise, lots of caffeine for some people can predispose to bladder symptoms, leading to loss of bladder control. So moderating caffeine is important, but of course don't forget about the perils of dehydration and maintaining good fluid balance, which is clearly very important. In later life, living on your own or with a partner, it's often very difficult to gain access to what's available. There's an increasing amount of resources available on the internet about local seniors associations, community organisations, many of which will run exercise classes, have memory clubs, have seniors activities. Some people don't like to be labelled with the term senior. But so again, joining local clubs, getting out there and engaging in social activities becomes very important. Likewise, the Seniors Association of Greater Edmonton, for example, and its equivalent in surrounding towns, have books of facilities that are available or information around clubs and classes that do take place for seniors. Of course, at the moment, with the coronavirus restrictions, once again, many of those centres are currently closed down and have moved their classes online. So I heard of online exercise classes, online yoga. That becomes a problem for people in very late life who don't have access or aren't familiar with those things. So finding alternatives is important. People often ask about moving in later life into more supportive living environments or congregate living, and really the medical profession are not the right people to ask about that. It becomes a very personal choice. We know about the benefits of a community and active engagement with other people. And it becomes a very personal choice about moving from one's home, familiar environment in order to move to a place where there may be a more structured day, there may be more facilities available for you to take advantage of and enjoy what might be an enhanced quality of life in a different environment. Speaking purely from anecdote, I have seen older people who have not been managing very well in their own homes, who have moved to congregate living, and because of that structured environment have almost flourished, enjoyed an enhanced quality of life, and clearly have benefited from a better health status as a result.